Hello friends, I'm Dr. Nimit Shah, your cardiologist. Today I'm going to speak on a very important topic which deals with the heart, especially people who have already had a heart attack or are at increased risk of having a heart attack. The timely treatment for the heart attack is very important because it saves life and also it prevents further damage to the heart muscle because that affects the quality of life as well. In fact, the data shows that people who have heart attacks, especially people who are more than 45 years of age, have an increased risk of having a further heart attack in next 5 years. So what steps we can do to reduce this risk? In fact, there are guidelines from American Heart Association how to reduce the risk of having a further heart attack. In fact, I compare cardiac patients with the car. For example, if you have a car and it gets damaged, you take it to the garage and the mechanic repairs the car and brings it back to the road. Similarly, if you have a heart attack or heart issues, you come to the hospital. If you have a heart attack, I would perform an angioplasty or my colleague would perform a bypass operation. But this angioplasty and bypass are temporary treatment. What is permanent treatment is work on the step to take steps which would reduce the further risk of having a heart attack and improve the quality of life. Similarly, once the car is on the road, what you do is you have to make sure you don't ride it rashly. You have a regular checkup, regular PUC, you check your oil, water, and make sure brakes, accelerator, all are working very well. So it prevents you going back to the garage. Similarly, the American Heart Association have said that if you take this appropriate step, looking after your body, the way you look after your car, where you have a regular follow-up with the doctor, where me or my colleague would check your routine blood tests, check your vitals, parameters, and do necessary intervention to reduce those risk factors and prevent you from having a further heart attack. Working with the cardiac rehab is equally important because the cardiac rehab would improve your confidence and get you back to your normal lifestyle. Working with the cardiac nurse, to keep in touch with the cardiac nurse, also a physiotherapist and also a psychotherapist. These all are very important. Last but not the least, reducing your risk factors. Make sure your blood pressure is very well controlled. Make sure your diabetes is very well controlled. Your cholesterol is controlled. You stop smoking. Reduce your alcohol intake. Reduce the stress in life and make sure you sleep properly. It's been said that if you sleep less than 6 hours a day, it increases the risk of having a further heart attack. To help you with all this, we have come with a program which is known as a LIFE program, LYFE. This is a program which is an online program, and as a group, as a team, my team would work with you hand in hand to improve your heart and also to improve your lifestyle. I suggest you look at this video to have more information on this LIFE program, and if you have any further information, do not hesitate to get back to me, and also the numbers which would have been given you in this video. Thank you.